There are so many options available in modern dentistry, it can become overwhelming to a patient. Dr. Sapoff refers to her practice as full disclosure dentistry. We ask her to explain.
Let's take the example of a patient who has had to have a tooth extracted. And so now they have a space and they have some choices. Now, what I have found is that a lot of dentists love to do implants, and they will do they'll say a lot of things to try to get that patient to get an implant because that's their favorite, procedure, and they make a lot of money doing it, or they make, good money to do an implant and then the implant crown and all of that. Well, there are other options. There are fixed bridges and there are removable partial dentures. And unfortunately, a lot of patients that have come to me, they have told me that they were never offered those options, or those options they were told that those weren't very good options, and that, they were told some negative things about those. And to me, that's like a classic sales approach in a dental office. And I don't really like that. I don't think that that's appropriate in a healthcare setting. I think what's appropriate in a healthcare setting is to tell patients what the pros and cons are of each option, even if it's a less expensive option, or maybe it's not the option that that dentist would want in their own mouth, but that's not what we're talking about. We're not talking about what would you want. We're talking about what does that patient want, and let that patient make their own decision. So, sometimes they have old metal restorations in the teeth on either side of that space, and getting a bridge is a way to upgrade those restorations to new tooth-colored, all ceramic restoration. And they don't have to pay extra to have that old metal or old crowns taken out because it's done as part of the bridge. And if that's their goal, then they would want to get a bridge so that they could just get it all done for that same price and not do an implant plus have to do those neighboring teeth. And then there's, for people who don't want their teeth to be cut or prepared at all, like maybe their teeth next to that space have never had a filling. And so, but they don't want an implant. They don't like the idea of having surgery. They don't want to have to wait. They really don't want surgery. They don't want an artificial root put into their bone that will never be removed. And a lot of the times it's metal, and then some patients don't want any metal put in their mouth. And so a removable partial, if it's in my office, we use only non-metal removable partial materials. They're flexible, they just snap into place. It looks exactly like a tooth. They're pretty inexpensive relatively, and they can use that for a while and maybe decide later that they want a bridge or something cemented in, or an implant if there are new materials in use, later. And so I just want to make sure that they have an idea of what all their options are, so that they can make the choice that's right for them, even if it's something that isn't particularly expensive. That doesn't matter to me. My fees are based on how long it takes to do things, not what the market will bear. And so for me, it makes no difference at all what they choose, as long as they're choosing what's best for them based on full information.
How do we find a natural dentist?
Finding a holistic dentist, or a dentist that's going to be conservative and respect your natural structures of your body and your mouth, and not drill away anything that doesn't have to be drilled away. That's really what you want, is someone conservative. There are some organizations that holistic dentists join. They're smaller than the American Dental Association, and there are a few of them. Go online and look up holistic or natural or biological dentistry, and you will probably be able to do a search and find a dentist in your area that's a member of one of these organizations. And then you want to call and you want to ask questions. If they're like my office, they have extra staff at their front desk available because they want to take the time with you and answer your questions when you call, so that they can make sure that you really want the service they provide and that they provide the service you want. They're not going to be trying to just get you to make an appointment, get you in. They're going to make sure that's where you want to be before you make that appointment and waste your time or the office's time. If anyone is looking for a dentist that practices similar to the way I'm describing, feel free to call my office, and we will give you the names of the organizations that you can look up and find a member in your area. And you'll have a higher likelihood of finding somebody that practices the way that you want your dentistry done.